Hello, my name is Patty Fisher. I have been an oncology nurse at Memorial Sloan Kettering Cancer Center for over 34 years and have been a clinical trial nurse for 25 years. Today, we will be talking about Clinical Trials 101. I would also like to thank the KCA for this speaking opportunity. My next slide shows my disclosures. Today, for clinical trials 101, we will cover types of clinical trials, clinical trial phases, review what a protocol is and the informed consent process, patient considerations, which will include deciding whether or not to take part in a clinical trial, patient safety in clinical trials, questions to ask your doctor and healthcare team, and we will cover some terminology. In my next slide, it shows the types of clinical trials. They include prevention, looking for a better way to treat disease, screening and early detection, to test the best ways to detect a certain disease, diagnostic, to find a better test or procedure for diagnosing a condition, quality of life and supportive care, which would study ways to improve comfort and the quality of life for individuals, intervention treatment, to test experimental treatments or new combinations of drugs or new approaches. Often, an intervention treatment has a quality of life component. The type of clinical trial this presentation will be focusing on is intervention treatment. In my next slide, clinical trial phases are the different steps that trials are conducted in. A clinical trial is a research study looking to improve treatments for people with cancer or other conditions. Clinical trials are conducted in these 4 phases. Phase 1, commonly known as the dose-finding phase, conducted to evaluate safety and identify side effects. Phase 2, they're using the new drug or treatment and looking at its effectiveness and safety. Phase 3, the new drug or combination of drugs are being used to see if it's better than an existing therapy. Perhaps the drugs in a trial are FDA approved individually, but not as a combination. Side effects are continued to be monitored in phase 3, and the trial size for phase 3 is about 1,000 or more people. If a clinical trial meets its goals, such as improving survival, it may move forward to be reviewed by the FDA and hopefully approved for therapy. Phase 4 drug has been FDA approved and its safety is continued to be monitored. In my next slide, looking at phase 1 clinical trials, we are looking at increasing doses in different subject groups. We want to determine the dose and schedule for what will hopefully be the phase 2 trial. The phase 1 trial will include additional sampling of blood work to look at pharmacokinetic or PK levels in the blood. Pharmacokinetic levels look at the level of the drug in the body at a given time. Sometimes a trial will ask for extra tissue samples of the patient's disease for additional research purposes. To continue, in my next slide, phase 1 trials are also looking at the maximum tolerated dose and the dose-limiting toxicity. This is terminology you might hear with a phase 1 trial. The maximum tolerated dose is defined as the highest dose of drug or treatment without any unacceptable side effects. This dose often becomes the recommended dose in phase 2. The DLT, or dose-limiting toxicity, is determined by looking at drug and treatment side effects. There are different designs for phase 1 trials. A more common one is 3+3 design. This is giving the same drug and same dosage to 3 patients. Dose changes may be needed to be made before the trial continues, depending on how the first 3 patients tolerate therapy. If this dosage is tolerated, the trial continues with a new dose level for 3 new patients. Next slide. A phase 2 trial tests an intervention in a larger group of people to determine efficacy or response and to further evaluate safety and toxicities. In kidney cancer, approximately 15 years ago, there was a drug, SUO-11248, being used in clinical trials. It went through the clinical trial phases. It was approved by the Food and Drug Administration. Today, it is known as Sutent or sunitinib. Next slide. Primary objective of a study states what the trial hopes to demonstrate. Since phase 2 trials are looking at efficacy, part of the trial is defining how disease will be measured objectively and report the response to a treatment. Response criteria are an objective measure of how a person's disease reacts to treatment. It is a consistent way to measure disease while on trial. The radiologist working with the trial will read the diagnostic scans every few weeks per the trial. They will make measurements of areas of disease, consistently monitor each scan, and evaluate for shrinkage, stabilization of disease, or progression of disease. 2 of the 3 response criteria listed here are for solid tumor. They are known as RECIST or IR RECIST. In my next slide, it discusses the clinical trial response categories once someone's disease is measured. So to answer the question of response and efficacy, the trial design will include criteria for measuring these responses. Clinical trial responses are organized into several categories. Response categories are complete response, which is the disappearance of all disease, no cancer seen on diagnostic scans. Partial response, disease is decreased in size, but still present. Stable disease, there is no change or minimal change in disease from baseline. Progressive disease or progression of disease, when a patient's scan shows an increase in size of disease and or new disease. The methods used to determine response are the RECIST or IR RECIST. The protocol states which method and version. The next slide, phase 3 clinical trials will accrue approximately 1,000 people and upwards, usually shared among institutions in order to accrue that many people. Phase 3 trials are conducted to determine efficacy of a drug or treatment by comparing the intervention to other standard or experimental interventions. Phase 3 trials will continue to monitor adverse effects or side effects and to collect information that will allow interventions to be used safely. A phase 3 trial might be double-blind and placebo-controlled, or comparing a new therapy versus standard of care. If placebo is part of a trial, it will be stated in the informed consent. An example of a randomized trial could be standard of care drugs in comparison to a combination of standard of care drug and an investigational drug. This is done as a clinical trial because the combination is not approved by the Food and Drug Administration. In kidney cancer, an example of this was Sutent versus ipilimumab plus nivolumab. The next slide, just phase 4 trial is when a drug is already FDA approved and continued to be monitored for long-term risks and benefits. Next slide. The clinical trial or protocol gives details about the treatment plan. It is used by your healthcare team to manage your care while on trial. Some specifics included are what drugs are being used, the doses, when the drugs are given, possible side effects, and how the study team should manage them. The principal investigator has the responsibility for all activities associated with conducting the clinical trial. This includes compliance with federal, state, and local laws, institutional policies, and ethical principles. The principal investigator must be qualified by education, training, and experience in the area in which the research is being conducted. They must be familiar with and follow the Investigational Review Board approved protocol, the regulatory requirements, and institutional policies and procedures. There may be several investigators listed on the protocol who participate by accruing patients to the trial. Next slide. When a patient is interested in a clinical trial, they discuss it with their treating attending and clinical trial nurse. Of course, you can and should discuss with your personal support team, such as your significant other. The informed consent will have the title of the trial written on it, naming the treatment. It will explain the trial, provide background or why the trial is being done. It will give a description of the drugs, and if a placebo is being used, it will be clearly stated. It will also describe the length of the study, how to take the study medication, other treatment options, and what your responsibilities as a patient are for participating. It may provide a table that shows the tests and procedures needed. It will list all the possible side effects known, but keep in mind that not everyone experiences them. The side effects will be listed in groups such as common, uncommon, and rare. The informed consent will also discuss information on stopping participation in the trial. The consent form contains a wealth of information. Signing the consent form is referred to as the informed consent process. In my next slide, perhaps you are considering a therapy or switching to a new therapy. Your doctor might discuss a clinical trial that is appropriate for you and that you are interested in, or ask your doctor if there is a clinical trial appropriate for you. There will be a consent form for you to read, take notes, and ask any questions you may have. Discuss these questions, discuss the trial with your doctor, discuss with your family and friends, write your questions down, ask all your questions. If you decide to proceed with this therapy, you would then sign the informed consent along with your treating doctor. At this time, the screening process officially begins. When you go on a clinical trial, there are tests that patients need to do for the trial, usually within a designated time frame before starting. It can be a busy time while trying to get all the required exams done in a timely manner so that you can begin your treatment. But typically, once on a trial, your appointments can be scheduled well in advance. My next slide shows the clinical trial team. Your clinical trial team will consist of the physician, clinical trial nurse, perhaps a fellow who sees you regularly at your visits. If you are receiving an infusion, you will also meet the treatment nurse. Depending on the trial, you might also need pharmacokinetic blood work done by the PK technician. Additionally, often behind the scenes, there are study coordinators and investigational pharmacists. Your clinical trial healthcare team is there to help you through the entire process. We want to answer your questions, help manage side effects you might experience, and keep you active. It may require adjusting your schedule, but we hope to treat your cancer and allow you to do the things you normally enjoy. In my next slide, patient considerations. Is a clinical trial right for you? A clinical trial may allow early access to promising new therapy. The drug may be supplied at no cost. You have a dedicated healthcare team. There might be travel reimbursement available. The trial will help investigators and scientists learn more about your cancer and may help others in the future. The trial might also require extra visits. It might have unknown side effects. Health insurance may not cover all the costs. The new treatment may be better or not as good as the standard. And with the trial, you need to adhere to the specific time frame for the clinical trial appointments and tests. If you decide to proceed, in my next slide, the screening process begins after signing the informed consent. The screening process reviews your test results to be sure that you can be included in the trial. They want to make sure that your blood work is within appropriate ranges. They have to look to be certain that a patient's had the number of therapies required for the trial or no therapies required per the trial. The typical tests prior to starting would be doing scans, blood work, perhaps an EKG, perhaps a bone scan, perhaps a scan of your head. You need to discuss screening test completion as well as when you will begin therapy with your healthcare team. Keep in mind that the tests need to be scheduled with time for your healthcare team to review to confirm that you are eligible to receive the therapy. Once your screening process is completed and tests have resulted, your healthcare team will let you know that you are eligible for beginning the trial. As you begin your therapy, remember to keep asking any questions you have. Call your healthcare team with any questions or concerns. My next slide shows some additional resources for finding out more about clinical trials, insurance coverage with clinical trials, about your disease, and also getting emotional support during your treatment. In my last slide, I'd like to conclude that this timeline shows the current treatments available for metastatic kidney cancer. Each of these therapies were once a clinical trial. Clinical trials are an important part of making treatments better for cancer care. Thank you for this opportunity. Thank you to the KCA.